This is your National Registry Dynamic Cardiology Station. You are an ALS unit, 3-man team, dispatched to a 42-year-old male's home. Chief complaint, dizziness and nausea.
Okay, BSI, is my scene safe?
It is.
Is this my only patient?
It is.
Okay, do I have a mechanism of injury, nature of illness right now?
Nature of illness is he just doesn't feel right.
All right, as I approach my patient, what is my general impression of both the patient and the scene?
Scene is good. You see the patient as he is, sitting in a chair in the living room, kind of hunched over.
Any need to consider C-spine at this time?
No C-spine.
All right, as I approach, I'm going to assess his level of consciousness and his airway. Sir, my name is Janie. What's going on today?
I don't feel good at all. I feel dizzy. I feel like I'm going to throw up.
You feel dizzy and nauseous? How long has this been going on?
Not long, just the last 20 minutes.
Okay, my patient is alert. He has a patent airway because he's speaking to me. So I'm going to assess his breathing. What's the rate and quality?
Rate is 24 and shallow.
24 and shallow. Okay, I'm going to place him on a non-rebreather, 15 liters per minute. While my partner does that, I'm going to assess circulation. What is the rate and quality of his pulse?
It's too fast to count.
Okay, and skin, color, temp, and condition?
Cool, pale, diaphoretic.
All right, I'm going to consider my patient a load and go. So I'm going to move him to the back of the ambulance. Once we're there, I'm going to place him on the cardiac monitor. Have my partner start an IV, and at this time, I'd like to get a first set of vitals.
What would you like?
Blood pressure?
92 or 68.
Okay, respirations.
24 shallow.
All right. Pulse rate?
Monitor shows a rate of 216.
Okay, blood glucose level?
90,
O2 sat?
97%.
Okay. I noticed on the monitor that my patient is in SVT. I would like to start by performing some vagal maneuvers. All right, sir, I'm going to need you to take a deep breath, and then I want you to bear down and push like you're taking a bowel movement. Do I notice any change? I still see SVT. So since that did not work, I would like to go to adenosine. My first dose is 6 milligrams, so I'm going to draw it up, making sure that I have the right patient, right medication, right dose, right route, right time, and right documentation. So I'm going to draw it up, making sure that it is 6 milligrams of adenosine. Going to administer it, fast IV push, followed by normal saline bolus.
Oh. I feel like I'm going to pass out.
All right, my patient looks like he's displaying signs of being unstable. What does the monitor look like?
Still the same.
Still see SVT, okay. So my patient's LOC has changed at this time. So I'd like to assess CAB for circulation, airway, and breathing. Does my patient have a pulse?
He does.
Okay. Going to open the airway, look, listen, and feel. Is he breathing?
He is breathing.
Rate and quality.
He's breathing 10 times a minute and very shallow.
All right, I'd like to place an OPA to help keep the airway open and have my partner use a BVM to ventilate the patient. 1 breath every 5 to 6 seconds on high flow O2, 15 liters per minute. I'm also going to check the monitor. I still see he is in SVT. So I'm going to prepare to synchronize cardioverter. Once my pads are in place, I'm going to set the monitor to sync. Select 50 joules to start. charge it, and once it's ready, I'm going to clear the patient. Clear the patient. I'm clear, you're clear, everybody is. Shock. We're going to continue ventilations. Going to recheck the monitor. I note a normal sinus rhythm. Does my patient have a pulse?
No pulse.
Okay, he is now in pulseless electrical activity, or PEA, with an underlying normal sinus rhythm. So at this time, I'm going to initiate CPR. I'm going to have my partners do CPR, 100 compressions a minute, with a rate of 30 compressions to 2 breaths. At this time, I'm also going to administer 1 milligram epinephrine, 1 to 10,000 IV, while they cycle through 2 minutes or 5 cycles of CPR. Okay, so after 2 minutes, I'm going to stop, going to check for a pulse and look at the rhythm.
Still no pulse.
No pulse, all right, I'm going to continue CPR. We're still doing 30 to 2, 2 inches deep, 100 compressions a minute. At this time, I'd like to rule out my H's and T's. I'm going to consider hypovolemia, hypoxia, hyper or hypokalemia, hypo or hyperglycemia, hydrogen ion acidosis, hypothermia, toxins, tension pneumo, thrombosis, either pulmonary or coronary, trauma, and I think that's it. So after 2 minutes, we're going to do another rhythm pulse check. So I'm going to feel for a pulse as I look at the monitor.
There is no pulse.
No pulse. All right, we're going to continue with CPR. I note sinus tach on the monitor.
That's your rhythm. That's your rhythm.
Okay, at this time I'm going to consider intubation. Push another milligram of epinephrine, 1 to 10,000 IV. After 2 minutes, we're going to stop and feel for a pulse and assess the rhythm.
No pulse.
All right, I notice VFib, so we're going to defibrillate the patient. Since it is a biphasic monitor, we're going to set it to 200 joules. Charge it, and as soon as it's ready, clear. I'm clear, you're clear. Shock. Continue CPR for another 2 minutes. After 2 minutes of CPR, we're going to do another pulse and rhythm check. Feel for a pulse and look at the monitor. Do I have a pulse?
No pulse.
Okay, I note asystole, so I'm going to check it in another lead. And we're going to continue CPR. If it stays in asystole, we're going to deliver 1 milligram epinephrine every 3 to 5 minutes. Continue with CPR, 32, or now that we have intubated, we're going to ventilate every 5 to 6 seconds. And we're going to transport to the hospital. After 10 minutes, consider sodium bicarb.
This concludes your Paramedic National Registry Dynamic Cardiology section.